My name is Amanda, and I'm going to do a head-to-toe assessment on my son, Heent here. First, I'm going to come in the room, explain to him who I am and what I'm going to do, provide privacy, wash my hands. I'll come over here and talk with him a little bit, kind of get his level of consciousness, probably have him walk so I can check his gait, make sure he's alert and oriented, can tell me his name, where he's from, and what year it is and whatnot. So I'm first going to start with his head and face. I'm going to look at his face, make sure it is symmetrical, that he is alert and oriented and can talk to me. And I will check his head and palpate his scalp to make sure that there's no abnormalities with his skull. Here. Here looks good. Everything seems to be intact. Okay, so next I'm going to move on to his eyes. I'll take my pen light here. Okay, I am going to shine this light in your eyes. So I'm going to shine from this side, check his pupils. They are round and reactive. When I shine the light in them, they should get smaller. And the one that I shine the light in is getting smaller as well as the other one. Pupils are round. Okay, so I'm going to do a couple of different tests on you, and this checks your peripheral vision. I'm going to kind of go like this, and you tell me, you have to look at me, but you tell me when you can see my fingers on the side. So kind of look straight. You tell me, yeah. Yeah, okay. Okay, so I'm going to have you follow my finger in toward your nose. You did really good. Both eyes went the same way. And I'm going to have you check the 6 points. Just watch my finger. You followed very well. I would also check his vision using the Snellen chart and have him stand 20 feet back, cover one eye, and then show me the letters, and then cover the other. And he's had good vision, so I know he's good there. Okay, so let's see. Next we'll check your ears. Just gonna kind of feel for any abnormalities. Ask them if he's had any recent hearing loss or drainage, discharge, that kind of thing. Kind of inspect the ear. Have you had any pain? No? Okay. So then I would take my otoscope and look in his ears, check his tympanic membrane, which should be kind of a white silvery color. And I would do the same. In there. Ask about history of any ear infections, anything like that. Okay, let's see. So next I'm going to check your nose. Have you had any abnormal drainage other than like just a runny nose? No? Okay, I'm going to take my line. Have a look up there. I'm just looking at the cilia, see if there's any deviated septum. Everything looks good there. Midline and symmetrical. Have you had any sinus pain or pressure? Probably not. Okay, so next I am going to check your mouth and throat. So if this were an adult, I would ask if they smoke or drink. And so I'm going to inspect his mouth. So show me your teeth first. Looks like he has all of his teeth other than the ones he's lost recently for his age. I might talk about if this were a patient that were older, any dentures or mouth or oral care. So I want you to open your mouth, stick your tongue out. Okay, looks like you've had some candy, but it's pink and moist. Take a look at his tonsils and his uvula. Okay, open your mouth big. Now his tonsils, I call them kissing tonsils. They're always a little bit red. swollen, and he's also had kind of a cold recently. But his uvula is midline and just kind of like a one shape, not split. So if I had a tongue depressor, I would stick your tongue out, say ah, and then I'd check gag reflex. But his mouth looks nice, pink, moist, no signs of dehydration. Any pain in your mouth? No? Okay. Mm-hmm. So next I would check your neck. So I kind of feel for any masses. Check to feel if you can feel any lymph nodes, any swelling. Can you swallow for me? Okay. Thyroid's good. What about range of motion? Can you kind of turn your head side to side? Any pain? No? What about up and down? Does that feel okay?
Yep.
Yeah. Okay. So it seems like he has good range of motion and he's holding his head up well, so he has good muscle strength. Okay. So next I'm going to check your heart and your chest. So kind of sit up straight. Okay. So you kind of straighten your shirt out. I'm just going to palpate, feel any crepitus, any abnormalities, any pain, your chest or anything like that. Okay. All right. I'm going to take a listen to your heart then. So I'm going to auscultate his heart here, and I'm going to make sure there's no murmur. Sleepy. Make sure there's no murmur. Listen for S1, S2. Make sure he's got a regular heart rate, between 60 and 100. Great heartbeat. Listen for the urge point and the fifth intercostal space, nuclear line. And I don't hear any murmurs. Normal heart rate. I'm going to check your pulse as well. Good. Can you take a deep breath for me? Any pain when you're doing that? No? Okay. I'm going to listen to your lung sound, so I'm going to come on your other side here. So whenever my stethoscope touches your back, take a deep breath in and out, okay? Good job. One more. Alright, he sounds really good. If this were an adult, again, I would ask any smoking, any history of lung disease, bronchitis, like any recent infections, possibly even ask about health history in the family as far as cardiac and pulmonary were concerning, just to kind of rule out any cancers. So, all right, I think that concludes our assessment for today. Thank you.